Good. Connecting. Good. Great. Okay, so welcome everyone. This is the third edition of the Foresight Sanity Preserver. Just to give you a little bit of background, Foresight Institute is an institute that tries to advance beneficial technologies for the benefit of life. We have a really long-term view of the future. We focus a lot on risk as well. And this is currently pretty unprecedented times. So I'm thinking that, you know, rather than like I've been kind of like wildly trying to see what makes sense to do right now. And I think one thing to do as Foresight, which is a big coordination engine, is just to try to make sense of the situation and try to kind of like first and foremost kind of like create community, because people are currently being quite isolated. So trying to get and kind of like create a benefit out of this and connect actually more people globally, which is something that we haven't really done before. We were quite Bay Area focused. So I'm really, really happy. Yesterday, we had people from all continents join. And so I'm super glad about this. Second of all, I think this is a good time to create community resiliency, right? This is a really good kind of like test case in how we are able to show up for each other. And then I think thirdly, like beyond COVID, trying to like surface opportunities and how we can use this kind of like to spearhead and kind of kickstart ideas that would have otherwise seemed crazy, based on the Milton Friedman quote that only a crisis, actual or perceived, produces real change. When that crisis occurs, the actions that are taken depend on the ideas that are lying around. And so this salon is kind of trying to focus on kind of picking up those ideas. I think today is kind of like a little bit of a like welfare day, because I think you know it's really hard to engage how isolating this experience is for many people, and so we're hoping to do a little bit of that today. I think before we kind of start, before I introduce Nell, I have created a poll, which I'm going to launch now. You should be able to see it, and I would be super grateful if you could answer the questions in that poll. It basically asks, for who is it the first Foresight Salon, the first Foresight meeting? Then where are you located right now? It doesn't have Oceania on there yet, but I'm working on it. And then how is everyone feeling right now? And maybe, you know, that will provide us some good kind of context on how we can go about the session today. All right, I'll give you a few more seconds, and I'm seeing a lot of people are now filling in their votes already. That's great. Thank you so much. Wow, it's so interesting. And I'm so grateful that currently, like whenever we've done the poll, most people here have actually not been to a Foresight Salon in person before. That's showing me that this is working, that we're actually creating a stronger globally knit community from this. So that's awesome. Currently, 80% have not been to a Foresight Salon before. And then for who is it the first time at a Foresight Salon? That yeah, is 80%. Then where are you located? North America, I think 69%, Europe 19%, Asia 0% for now, 13% in Africa. So that's great. How's everyone feeling? We have everything from like a 2 on the negative scale, then like a 3, so feeling quite okay. That's 44%. Then a 4, 31% of you actually feel quite positive, and then very positive, we only have 6% feeling very positive. All right, so that's really nice to see. All right, so with that being said, I would love to introduce Nell. Nell has been in one of our, I think, first fellowship classes and has blown Foresight away. I remember when you came speaking at a Vision Weekend, and your approach to machine ethics was, and your graciousness in approaching machine ethics has touched the Foresight community really deeply. So thank you for that. Also, Nell has been spearheading a lot of efforts to kind of like to benefit this community on a larger level. Now focusing on COVID-19, and so today's session is really trying to focus on kind of making sure that everyone here is all right and cared for, so that then we can go out and help others better. And thank you so much for joining, Nell. It's really a pleasure. And with that being said, I want to give the stage up to you for an about 40 to 45 minute talk, and then a Q&A session. So with that being said, I'm gonna turn my video off to save bandwidth here, because we're isolating in the woods. But Nell, the stage is yours. I'm really happy you're here.
Thank you so much, Alison. Okay, so let me just share my screen and hopefully this will work. Everyone can see okay? Maybe I need to put that like that. Can everyone see okay?
Yes, thank you.
Super, thank you very much indeed. So I'm going to talk a little bit about how we can help to protect our health in a physical sense and also in a mental and emotional sense. Different tips that may help us. It's what I'm calling an MRE of info. It's kind of very dense in information, not necessarily easy to digest, but I've done my best. It's still kind of a prototype. So here we go. We are clearly facing a major worldwide crisis, and it has multiple centers. I suppose the current epicenter is the Italian hot zone, although it seems as if it may shift towards the United States in a week or two. The situation in Italy is very bad indeed. They are having to ration or triage medical assistance, medical equipment, things like ventilators, and that is creating a very horrible situation. And unfortunately, it seems as if other locations as well are going the same direction. Ventilators are in particular direly needed and in very short supply. And typically, if a patient has to go into hospital, particularly in the ICU, they are ventilated for, on average, I think the median is about 22 days. So that's 3 to 4 weeks. So they're taking up all of that time and resources. And when they come out of it, they are bound to be affected by this. It's going to leave them with some loss of brain function, which may be lasting. It may eventually go away, but it's not something you can kind of bounce back from very soon. As most of us are aware, those who are older or who have comorbidities, other conditions, are especially at risk. Now, we talk about 80% of people having mild symptoms, but mild in medical terms means something a little bit different. Mild is essentially anything that doesn't require hospitalization. So you may be feeling like you're at death's door for a month, but as long as you're not obliged to take oxygen in a hospital, you have a mild case. So a lot of those so-called mild cases may be quite nasty indeed. A lot of people who are younger and healthier often feel a little bit invulnerable, but unfortunately we're finding that young people or younger people, younger healthy people are also at risk. And there have been a number of different horrible anecdotal reports of very young people, even in their teens and early 20s, succumbing to this disease. Another issue is that there are a lot of asymptomatic, or sometimes called pre-symptomatic cases, and we're finding that there are a lot more of these than we initially believed. And so you cannot make any assumptions. You know, anyone who has not been in self-isolation for a couple of weeks is potentially a carrier of this disease, no matter how hale and hearty they may appear on the surface. We're also finding examples like this cruise ship on the Nile River, which had about 150 passengers and crew, but about 45 people, at least 45 so far, tested positive, despite none of them having any apparent symptoms, at least at the time. We're now learning that COVID is extremely transmissible. We must break the chain of transmission. It starts and ends, it must end with us. We can take ourselves out of the chain into self-isolation, and in so doing, we can protect others. In fact, there have been some calculations that say that if one person gets sick, they may make 30 other people sick eventually. and statistically, at least one person is likely to die. So if you want to get your angel wings, be a sweetie, stay at home, and isolate yourself as much as possible. The transmission methods, there are essentially three major ones. Droplet and aerosol, that's basically coughing, sneezing, and breathing in that kind of matter. Contact with something that is contaminated and then touching one's mucous membranes, that's the eyes, the nose, and the mouth. And also, we believe, fecal oral, although we're not quite sure. But there is more and more evidence coming out that the virus can live within the gastrointestinal system. So let's start with fecal oral. How can we stop that? That one's fairly simple. Essentially, when you go potty, put the lid down to flush. Make sure you wash your hands very carefully and avoid public restrooms as much as possible for obvious reasons. When it comes to droplets and aerosols, they can travel an immense distance, up to maybe 5 meters or so, 15 feet from one sneeze or cough. But if we can put a mask on someone, then that changes things. You notice that they're not going all over the place. They are hovering in a small cloud in the immediate vicinity of that sick person. This is why masks and physical distance are so important, why we should stay at least 2 meters or 6 feet from everyone, and ideally wear a mask as well. Masks are in many places quite hard to find, and therefore they are sometimes best spent on a sick person than a well person. For example, if you have a building or a home that has 5 people in it and one of them is sick, putting a mask on that one sick person will help to protect the other 4. I'm sure you can understand the logic in that. We are finding, or increasingly evidence is suggesting anyway, that masks have a big difference in the outcomes on a population scale of transmission. Essentially, those locations which have masks or use masks on a population level, even if their counter-transmission methods are not too draconian, they seem to have quite good outcomes. For example, Japan and Singapore and South Korea. So I would suggest as much as possible that we all wear masks. Problem is, of course, these kinds of commercial masks are in short supply. So we have 3 major kinds, sort of the FFP1, FFP2 or N95 and FFP3. Essentially, surgical masks are there to primarily protect others. That's why they're best used on a sick person. Although if you wear them, you will also have a reduced likelihood of contracting something. The N95 style ones, with or without a valve on them, are designed primarily to protect the wearer. They're not as good necessarily at keeping in coughs and sneezes, although they will also help. They also have these kinds of respirator ones as well, FFP3 ones. Those are reusable many times, which is sometimes a factor in which one to acquire if you haven't already. The N95 style can probably be reused over a few days or maybe up to a week. The surgical ones are harder to reuse. Also, you may find a FFP3 N100 P100 respirator with a face shield. Those ones are generally more ideal because you want to be protecting your eyes as much as possible. These kinds of quality masks should, as much as possible, be given or donated or sold to hospitals, because clinicians are the ones who are facing people who are very virulent all day long, and they desperately need them. And a lot of clinicians are stuck with having to try to make things out of scarves and bandanas and office supplies, etc. It's a mess. So if you have good quality commercial masks, please consider donating them, especially if you have them spare. However, the rest of us should, as much as possible, still wear a mask. However, as they are in very short supply, we should make masks for ourselves as much as possible. Even those simple surgical masks can still filter out about 80% of viral particles. And because those viral particles are often coated in moisture, they're actually a lot larger. It's a little bit like a bubble of surface tension of moisture around them. And so even very simple masks, a surgical mask or even a cloth mask, can be very effective. You should clearly label each person's mask so that everyone knows whose mask is whose, and only use your own. There are many different ways to fashion a mask. For example, here, Harvard Medical School recommends you can use some existing equipment, as you might find at a hospital, ventilator filters and anesthesia masks and some elastic straps. It's also possible to use a cloth mask, to make something out of cloth. Even some t-shirts or gauze can still make an effective protection mechanism. Nowhere near as protective as something purpose-built, of course, but still a lot better than nothing at all. And primarily, it will stop you from wanting to touch your face, which is one of the biggest protection factors, even beyond breathing itself. Here, I don't have time today to go through this video, but I really recommend checking out this paper mask. It was created by some scientists and doctors in Hong Kong. And even a couple of layers of paper towel can make a massive difference in how much particles we're likely to breathe in. I also implore you, if you have some skills or if you're looking to acquire a new skill, to help to make masks, and ideally donate or even sell them if you can, to give to others, because there is such a dire need today. There are many resources that you can look at with PDFs and plans and all kinds of things to help you. And potentially you can also impregnate some of these with saline or iodine to give them even more protection. Whatever you have to use to stop you from touching your face, use it. Whether that's a keffiyeh, ski mask, balaclava, a cycling buff, whatever you have, pull it out of the closet and start using it. You can even use a long sleeve t-shirt. Watch this smart kid. He kind of pulls it up around his face and then pulls the back over his head, and then takes the two long arms and ties them at the back. And then bingo, you have your very own ninja mask. Simple. Now, to put on a mask, or sorry, I've put that in the wrong order, but yes, to take off a surgical mask from the face, make sure that you take it off from the ears. Don't pull it off from the front, but take it off from the ears. Here's an example of how to put on an N95 style mask. First, wash your hands, of course. And then you'll see that there are two straps in this one. So raise it up to the face, put it snug against the face. And then the top strap, put that over your head, and then the bottom strap down to the nape of your neck. And that should keep a snug fit. And you also want to pinch it gently, pinch it at the nose to make sure that you have a snug and airtight covering. Gentlemen, make sure that if you have facial hair, that it is trimmed down to a mustache or a soul patch or a goatee, perhaps. Here are some examples from the CDC of facial hairstyles that they recommend. It may also be possible to recycle masks. This is not recommended. However, it may be necessary. There was a study came out that recommended taking the masks and sterilizing them in dry heat at 70 degrees centigrade, that's about 160 degrees Fahrenheit, for at least 30 minutes. You can use a dry convection oven, toaster oven, even a hairdryer to do that. Other studies do not recommend spraying with alcohol or bleach, as those can damage masks. They can denature glues, plastics, etc. You may be able to use ozone or UV, but again, you have to be very careful with those. Ozone is potentially quite dangerous. It's very toxic. And UV may either denature the mask or potentially not penetrate deeply enough. Perhaps the simplest way is to recycle PPE by simply putting it in a zip bag or in some Tupperware or something like that, and putting it away in a closet for 2 weeks, at which point any viral particles on there are probably dead. You should, of course, make sure to label that so that nobody else goes in and touches them or thinks, oh, these have been there for weeks, when in fact you only put them there a day ago. Also, masks tend to have a use by date written on them. Sorry, is somebody talking? Does somebody need to interrupt me?
I was talking because I was wondering, can people understand Nell clearly, or is it sometimes lagging? Is it sometimes lagging for anyone?
It's clear for me. Good audio.
It's been fine for me.
Okay, clear for you? Okay,
Yeah,
then it's
fine
just for me. Great.
for me.
Just go on. Go on, then it's
Good
on
to
my
hear.
end. That's great.
No problem.
It's good to hear
Good.
from you. Good.
Thank you very much. Okay, folks. So the last point here is that masks may have a use by date on them. And the use by date is often related to the elastic and not the filters or the mask itself. So you may be able to replace the elastic and still continue to use the mask. So if it's out of date, still don't necessarily throw it out. It's important as well to protect our eyes from droplets, whether that's swimming goggles, safety glasses, a ski mask or ski goggles rather, or less ideally spectacles or sunglasses. You can also, if you like, protect your hair. So with a swim cap, shower cap, a toque, or a snood. This will help to keep your hair from getting in front of your face, getting your hair contaminated in different ways, etc. Please don't travel in the air if you can avoid it. There are a number of horrible things that can happen to you if you're traveling. And now many countries are obliging people who arrive to pay for their own quarantine. So don't travel except to come home. This is especially the case because research from SARS, the first virus like this, showed that there was a strong probability that lots of people around a SARS patient on a plane managed to contract the virus. So please don't fly. But if you must, in order to get home, my recommendation is that you set the air nozzles to about 50%. This will create kind of an air shield around your body, but maybe don't set it all the way up to 100% because that might tend to dry out your mucous membranes, which would help to get germs in them. So 50% is probably the sweet spot. Touch and eat nothing. Just sit there like a sack of potatoes. Try not to use the restroom, and consider your passport and passes contaminated because whoever's been handling them, the TSA agent, the boarding gate agent, they've been handling hundreds of those things and they're probably very dirty. So try and put them in a zip bag or something like that, and don't let them contaminate items in your bag, in your pocket, etc. This is the kind of equipment that would be, in my estimation, suitable for traveling. Goggles, nice N95 style mask. I would also recommend using a head covering here as well. Even the hood of your coat, if you have like a duffel coat or something, that can help as well. For contact infection, these are your friends: wipes, hand sanitizer, gloves, and of course soap and water. Hand sanitizer should ideally be alcohol-based. Some of them use chemicals instead, but the alcohol is much more ideal. Please avoid shaking people's hands. It's very difficult because it's such a part of our culture. But you know, if you can, just give them a wave, tip your hat, take a bow, give them a namaste, even a curtsy, whatever it takes, but please don't touch the hands. Soap and water is very much your friend. This is because soap foam, and particularly warm water, breaks apart fats and oils, and the virus has a lipid layer, a layer of fat and oil surrounding it, and that's why soap and hot water particularly will cut this thing and kill it dead so quickly. Just 30 seconds of washing can completely transform how many germs are on your hands. It's very important, and it's very important to do it well and to do it properly. So here's some examples from the Mayo Clinic. Observe how the lady washes her hands. She washes for about 15 or 20 seconds. And then when she finishes, in this case, she takes a paper towel and she uses the paper towel to shut off the faucet, and then she disposes of it. I suppose also you could use your elbow as well, but if you have a paper towel or something handy, that's ideal. Only use hand sanitizer if you can't get to soap and water, because it's only about 30% as effective. Also, you want to keep it wet for as long as possible. So whilst it's wet, it's still doing its job. So don't be shaking it or anything because you don't like the tackiness. Just suck it up. You can, of course, make your own hand sanitizer. The WHO has produced 2 different recipes. However, if you do try to make your own, follow the recipe to the letter, because people have been harmed by creating their own little George's Marvelous Medicine and ending up hurting people. Do not ever mix isopropyl alcohol and bleach, or bleach and ammonia. Please try to avoid taking any risks that might put you in the hospital. Now it's not a good time to be sent to the hospital. The virus cannot go through healthy skin. However, hand sanitizer makes hands sore and dry, so I really recommend using a lotion to protect them. I use something called E45 that helps me a lot, brings them right back to normal again very soon. You can also use copper tape. So copper tape is something you can put on just about any kind of hard surface, and it doesn't kill viruses stone dead, but it really helps them a lot. So, you know, you can put these on just about anything that people are wont to touch a lot, or even be a public spirited person, put them on stoplights and things like that. Try to avoid touching handles, like in bathrooms, as much as possible. Try using a paper towel or using your elbow or even a coat pocket. For example, if you're using an elevator, don't touch it with your fingers, maybe use your elbow instead. There are also helpful grabbing devices that you can 3D print, whether it's in plastic or metal. And these kinds of devices are very handy for all kinds of doors and things like that. Now, gloves are a great way to avoid getting our hands contaminated, but taking them off can be tricky. So here's how to do it. Pinch them at the cuff, like so, and then pull them off carefully, inside out. Then bunch up the glove with the other hand, and then take your now naked hand and put your finger on your forearm, and then move your finger down your forearm under the glove and then out, and then peel it off like that. And then you have gloves inside out, which are safe to immediately dispose of. Please disinfect your devices. They are filthy and disgusting. I know it, you know it. So make sure that you can wash them in soap and water if they are IP67 or IP68 waterproof. You can also wipe them down or spray them with isopropyl alcohol or wipes. You can also, of course, keep it in a zip bag, and that way you can later take it out and it's unlikely to be contaminated. A lot of people are wary of using chemicals on devices, but The device manufacturers say that it's okay to use things like Clorox wipes on your device. Just, maybe don't use bleach or anything caustic like that. Try to avoid playing games which have cards or chips or tokens, as that's a great way of transmitting fomites, little bugs that get transmitted between people. Try to avoid the gym. Lots of people working out and breathing hard, etc., is a wonderful place to pick up all kinds of nasty germs. However, fitness is really important. It's very important for your health, and you don't want to be putting on lots of weight when you are in quarantine. So work out from home. Maybe follow home workout videos, do some push-ups. If you have a dumbbell or a gym ball, use it. Please avoid cinemas and theaters if they're still open in your locale. Avoid bars and nightclubs similarly. Try to avoid the hairdresser. They've been in close proximity to dozens or maybe hundreds of people that week. It's a good rule of thumb to just steer clear. Similarly, avoid the dentist unless it is an emergency, and avoid your beautician as well. However, importantly, keep your nails short. All kinds of horrible gunk gets under there, and it's very important that those are kept clean. Consider fulfilling your spiritual needs solo or virtually with other people. If there's a congregation of people, wherever they happen to be, of course, transmission is going to be so much more likely. So if you can fulfill your needs by yourself or virtually, that's so much the better. Please try to avoid or minimize the use of public transport as much as is possible. You can work from home, or you can maybe stagger your hours so that you're working at off-peak times. That means that you're less likely to encounter other people on cramped public transit. Ensure that you maximize airflow. This is a very big deal for breaking up viral particles indoors. So if you can bring the outdoors indoors, you will be much, much safer. You can also do this, of course, in cars or taxis. Wind that window down. Or take things outdoors. This is a quote from the Great Flu Pandemic of 1918, where they held court outside. We should learn from our wise ancestors. There are also some studies which suggest that humidity and high temperatures will tend to denature viruses such as COVID. The sweet spot is probably around 40 to 60% relative humidity. If there's not a curfew, you may be able to go and take a walk. And this can be a wonderful thing for your soul and your body as well, of course. Make sure that you stay at least 2 meters or 6 feet away from anyone. And I recommend that you carry your ID with you and that you write down your intended activities before you leave, because in some countries they want to know where you're going and why. It's also possible, if you're out and about, to enjoy a picnic. This can be a wonderful way of boosting people's morale. It's nice for celebrations like birthdays, etc. Keep a red zone in your house. The red zone is where you store things which are potentially contaminated, and it's best to keep a red zone by an entrance to your home. Don't go into the red zone unless you're prepared to decontaminate. And if somebody gets sick, their spaces, like their bedrooms, etc., those become red zones too. When you go into the house, take off your shoes and leave those in your red zone, just inside the door. Don't walk around your house in your outdoor shoes. Alternatively, you can protect your shoes with these boot covers or even using a plastic bag. If visitors come calling, tell them to phone instead. Sorry, no visitors. If you go out shopping, I recommend that you look up on your map application to figure out when it is less busy and to go at those times. You can even sometimes get live information on how busy a store is. Some stores now have special hours for older people or for healthcare professionals where they can go and get their shopping in safely. This is usually at the start or very end of the day. Don't take reusable bags with you. They can carry all kinds of germs. Instead, take a disposable bag from the store, and then you can use that disposable bag to bag up any potentially contaminated items that you may have. When you get to the shopping mall or store, wipe down the shopping cart or basket before you use it. I always like to think of Alanis Morissette when I go shopping. I always have one hand in my pocket and the other holding a grocery bag. And this helps one to remember not to touch one's face. When you pay, try to go contactless using your phone or using a contactless debit card. Don't put the virus in your fridge when you get home. Wash your produce or wipe it down if it's something impermeable like in plastic. Be aware that a lot of online stores are experiencing incredible pressures, and sometimes waiting times are a couple of weeks. So if you order anything, don't expect to get it soon, and don't wait until the last moment to order things. If you get packages in, if they are non-perishable, you can set them in your red zone. Alternatively, you can rub them down with disinfectant or rip everything apart carefully and dispose of all the packaging immediately, being very careful and washing your hands thoroughly, of course, afterwards. Please do not lick stamps. This is a perfect way to contaminate the entire mailing system. Just don't do it. Thank you. A lot of restaurants are now beginning to shut down, but of course, the virus is affecting different countries in different ways at different times. Please don't eat out. But if you must eat out, either enjoy it al fresco outside in the air where it's safer, or order ahead and pick it up to go. And now a lot of restaurants are moving to drive-through only service. It's best to order something which has been cooked at above 65, 70 degrees centigrade. Things like salads, fruit desserts, etc. They're more likely to have been contaminated somehow. If you order from a food delivery app, you can ask it to be left at your door. And please tip your rider very well. They're literally taking their life in their hands, and try to be understanding with any menu substitutions. Something difficult to talk about, but very important, is to make sure that you have your last will and testament ready, along with payable on death instructions, so that family members aren't left in the lurch as to cash. Update or make your will, your estate plan, and set your medical proxies. Have a look at your guardianships, your trustees, executors of your will. Are any of them at risk of coronavirus? You might consider adding a few other people as well in case the worst should happen. Also, check on your life insurance policies and health insurance as well. And one other thing, again, difficult to think about, is the potential of creating a living will. If you happen to be somebody who is potentially at risk of being triaged out of receiving intensive care service, you can specify in a living will that if anybody terminates your medical service, that they must immediately terminate your life peacefully as well. Just a horrible thing to think about, but potentially very important as well. If you are getting paperwork sorted out, please take a lucky pen with you. Don't use anyone else's lucky pen to sign any contracts or agreements. Something that's potentially quite important as well is to make sure that we get plenty of vitamin D. There have been studies, meta-analyses no less, which suggest that there's a substantially lower likelihood of getting chest infections or serious complications from viral and bacterial infections for people that have taken a vitamin D supplement. They recommended for people in the UK that they get at least 10 micrograms daily. And this is particularly important for people who live in high latitudes, so very north or very south on the planet, who happen to have darker skin. This means that they're less able to get vitamin D from sunlight. There have been some discussions, this is quite controversial, but there have been some discussions that SAIDs, non-specific non-steroidal anti-inflammatory drugs such as ibuprofen and aspirin may not be ideal for treating the coronavirus. So where possible, try to use paracetamol, acetaminophen, or Tylenol instead. Possible exceptions if you're really stuck and if you have a high fever, but consult your physician. This is information which is a lot of people are saying different things about. So don't take it from me, but something to pay attention to. If you're streaming a lot, please be a sweetheart and try to stream at a lower resolution. Higher resolution uses a massive amount more bandwidth. And I don't know if you've noticed, but these days there's a little bit more lag and chug on the networks than there used to be. I recommend getting a pulse oximeter. They cost as little as 10 bucks. This will really help you to know when somebody might be getting into respiratory distress if they're not getting enough oxygen into their bloodstream. The danger zone is typically around 92 to 93%. If it gets into there, then you definitely want to inform your physician and possibly call an ambulance as well. Good sleep is really, really important for not getting sick. You must get 8 hours if possible, and try not to use electronic devices immediately before bed. And there's been some wonderful tips at this link from Clearer Thinking that I really recommend checking out. If you're eating, seems pretty much a no-brainer, but please remember to wash your hands and please don't share food or drinks. Some people have wondered if getting an influenza virus vaccine or pneumonia vaccine, pneumococcal vaccine may be helpful. Potentially, yes, in case of cross-infection, which combined with COVID could be very nasty. But of course, going anywhere near a clinic for many parts of the world at the moment has its own risks. So weigh that one up, and if in doubt, ask your physician. Now we come to something a little bit disturbing, is that there have been reports of 2 dogs which have apparently caught the coronavirus, and one of them has since died, although that dog was 17 years old, so that's maybe not so surprising. There was also some research that came out from SARS that cats and ferrets are known to be capable of catching SARS. However, there is no evidence that pets can transmit a disease back or transmit the coronavirus back to human beings. However, it's a very good idea to keep your pet away from other people who might want to touch or pet it, to keep it corralled in a known area, and perhaps also to wash their little paws as well. One known symptom of COVID, which has emerged recently, is a loss of smell, or anosmia. They've discovered that about 30% of patients in South Korea and in other places have developed anosmia, or lack of smell. We don't know yet whether this is lasting or whether it can recover or not. But if you suddenly recognize that you're not smelling things as strongly as usual, this may be an early warning sign. We're seeing a lot of animals which are doing strange things or showing up in places that they usually don't. some of them could be potentially dangerous. So be aware that animals may be acting differently now that a lot of humans are indoors. Children can contract the virus. Usually their symptoms are relatively mild, but they definitely can pass it on to other people. If you have older people in care, you may consider bringing them back to the family if you think that you are at a low risk of having contracted the virus. However, if you have older people and you're mingling with them, please, if the kids are off school, don't ask grandparents, for example, to look after children, because that could be a bad idea, that the child could unknowingly transmit something to that older person. Please, please consider donating blood if you are young and healthy. There is a dire shortage of blood right now, and it's only getting worse. If you're older or off the hook or have recently had the virus, that's okay. You're, you know, we can do without you. But you know, if you have the possibility to donate blood, please do. If you happen to feel sick, please stay at home. Put on a mask, such as a surgical one, ideally, if you can, and isolate yourself away from others. Here are some examples of different symptoms to kind of do a bit of a differential diagnosis between COVID, flu, and the cold. And you can also assess your symptoms at these 3 links that I've put at the bottom. If you're sneezing and sniffling, it's not ideal to do it into your hands or into your fist. It's much better to do it into your elbow or into a tissue. And as they say, catch it, kill it, bin it. Tissue is ideal. This brings me to something else. We are experiencing a lot of mounting food pressures, which have been born as a result of the virus. Because of lockdowns, because of a lack of farming labor, because of migrant labor, because of issues of getting food to markets, a lot of food has been wasted, whether that's seafood or vegetables or strawberries or poultry, for example. And so vast amounts have been wasted or left to rot, which is rather tragic, particularly because parts of the world, such as China, are already facing issues from swine fever and bird flu, which are affecting meat production. Meanwhile, we have issues with locusts. There are locust swarms now, which have been eating up all kinds of produce in a wide belt, stretching from Sudan right the way to Bangladesh and Western China. And all of this means that, you know, there's less food to go around. I don't think we're going to see widespread starvation, but I think that food prices are likely to go up, and that's something that we should bear in mind for the second half of this year. So, if you like, you can build yourself a little victory garden. Plants such as cress, alfalfa, and spinach can grow in as little as a few weeks or even a few days, and they can be very nutritious. And you don't necessarily need to be digging in your garden. Even if you just have a balcony or even hanging one off the side of the window, you can grow fresh and tasty, nutritious food. There have been a lot of economic disruptions ongoing as well, a lot of flip-flopping of the markets, kind of like an earthquake in many ways. And sometimes these kinds of effects can be more disruptive to life and to livelihoods than even the virus itself. This has also, I think, contributed to a lot of attacks on people who, for whatever reason, are perceived as being different. And this is particularly tricky in a time when public security is at a low point, because a lot of prison breaks in countries like Italy and Brazil, or countries kind of deciding to parole a lot of prisoners as well, because of ongoing tensions. And so I recommend that you think about your personal safety, whether that's some kind of spray or some kind of firearm. If you are trained to use that and confident to use it, it's a good thing to have just in case. All of these kinds of effects are likely to create a lot of widespread trauma in our society, whether that's trauma from people grieving for lost loved ones, loss of jobs and businesses, despair about crime or loss of the social order, or worries about resource constraints. All of this is going to be pressing upon people, as well as, of course, fears and issues with isolation, which is no fun either. The trouble with this particularly is that it tends to enhance pro-inflammatory cytokines, making the potential disease of the coronavirus even worse. Now, we tend to think about adjustment according to this kind of Kubler-Ross style model, which says that people move in a roughly predictable order through these different stages. And, you know, that makes sense perhaps in a world where you're adjusting to one thing. But with coronavirus, it's coming at us from all over. And, you know, some of us are getting information and others are still kind of waking up to information. And so people are going to be at different stages, and that might be a little bit frustrating at times. Especially because we're now starting to see research out of China, which suggests that there were a lot of divorces because people were cooped up together. And so I really implore all of us to be there for others, right? Be there for others. If you have courage at this moment, share it with others, even though none of us know what's coming tomorrow. Be forbearing and forgiving of others, and help people to find meaning in this, right? To take some meaning from these ongoing struggles. Because if we can find that meaning, that can help us to endure in the very worst of times. I recommend befriending your neighbors. We are all in this together. You can do a little asynchronous exchange of information through notes or posters, etc. I've got a little template I've put up here in case you want to say howdy doodly neighborino. I also recommend connecting on nextdoor.com, which is sort of a social network for people who live in a locale. And I also really recommend, if you can, to help more vulnerable people to get groceries, particularly the heavy ones like big bags of cat food or cans and things like that. But if you do help someone, please remember to wear gloves, of course. Physical distance need not equate to social distance. There are things like quarantinechat.com where you can go and talk to others, or of course, call up an old friend, or even play an online game together, and particularly cooperative ones where you are working together to solve problems. Those are lots of fun. If anyone is feeling a little bit touch-starved, you can take a cuddly toy with you, and it may seem a little bit juvenile, but for a lot of people, it really, really helps. Try to keep a regular routine. If we don't have to get up and go anywhere particularly, it's easy to end up waking up afternoon, etc. Keep your place tidy, keep a routine. All of this will be good for your mental and emotional health, as is sunshine, whether that is through a window, whether that's going out into your garden. Sunshine is great for your mood, and of course, it will help boost that very important vitamin D as well. Make some quiet time for yourself and for everyone else, right? Whether that's in your private space or whether that's in your own little moment all to yourself. try to find a creative outlet, whether that's creating a journal or creating art or poetry. Sublimate those emotions and get them out of you. If you are particularly creative in an engineering or craft way, you may help to create new ventilators. This is something which is so crucially important, of course. It's possible to be creative in how we use a ventilator to get more people connected to it. In fact, it may be possible to run 2 or 4 ventilations off one machine. A lot of people have been creative with using 3D printed parts to replicate very expensive and rare parts within ventilators as well. And there's some wonderful groups that I really recommend you take a look at here. It's also possible to use CPAPs or BiPAPs as ways of ventilating people, but this tends to kick a lot of viruses into the air, and so people tend to think that this is not a good idea. But we can solve that with these nifty little helmets. So if you're interested, have a look at this info. And finally, we're living in very difficult times, immensely challenging times. But I'd like you to think about it as if the stress of this was like what our muscles feel when we lift a weight that is heavier, or we lift something in a new way. It's supposed to feel uncomfortable when we do that. And that feeling is actually the feeling of us getting stronger. All of humanity is today united against a common foe. And that's never, ever happened before. Not like this. Not all 8 billion people trying to contribute to this fight. This is the greatest fight we've ever had in human history. And every one of us has to bring something, to bring the very best of ourselves to this fight. All of us are pulling together to strengthen society and save lives. It falls upon each of us to step up towards public leadership in our own way. And there are various different ways that we can do that. We can help with nursing. We can take care of vulnerable people. We can contribute to engineering and crafting. We can find new ways of exchanging information with people and trying to educate people. We can promote good messages and share them when we find them. We can listen to others and provide a crucial shoulder for people to cry on when they need it. Any way that you can find to champion human excellence and decency, do so. This is the work. This is war work. This is God's work, if you will. The spotlight of history shines upon us today. What will you bring to humanity's finest hour? Thank you. Thank you so much. If any of you would like to download those slides, please, you'll find them at tinyurl.com/Nell COVID-2. Please download them and share them as you like. Thank you.
Woo! Thank you so much, Nell. There was a ton of information in what you just said, and I think it's been compiled really, really easily, understandably, and I thank you a lot for it. I mean, I learned a ton about. I made my own little kind of like travel advice, and it included like a bed cover over the seat and so on that should then be dispersed. But it's been really, really, really helpful to see so much of you of your tips. So thank you for that. We are now over 10 minutes, but I would and you get a lot of thank yous as well in the chat. Wow, look at it. People are really popping in. It's been really, really fantastic. And maybe if anyone would like to raise their hand, we could maybe take time for one question in case you can go over time. for another,
I
let's say,
personally
3 minutes?
I personally have lots of time for this if anyone else does. Of course, you can always email me or ping me on social media as well, of course.
All right, let's see if anyone has their hand raised. Is there anyone?
So I have a question about, sorry, let me fix my camera. Okay, so my question is about so there are two ways of, so we have either using masks or surgical gloves, right? Without poor technique of wearing a mask, you end up touching your face a lot more, which is very it's worse. So is it more recommended to wear gloves if that's the case, or is it better to how do you deal with it? Because I've seen some people recommending gloves instead of masks because of that issue.
Thank you. That's a good question. Gloves will also help you not to touch your face because you'll immediately notice, oh, that feels weird. That feels gross, right? If you've got the sort of rubber touching your face, so that will help. I think both are important. Both are valuable. I would say I would probably agree that gloves are slightly more valuable than masks, particularly because we tend to touch all kinds of things, even when we don't notice it. So perhaps gloves could be a priority, but I do believe that masks are important, not even so much for ourselves, but actually for other people, particularly, right? It's not so much important on an individual level. It is very important on a population level, right? Especially because we're now learning that so many people are asymptomatic, right? There's been research has recently come out the last week or so that really shows a lot of people never notice that they're sick and yet they can carry it. So if you can wear a mask, you can protect others as well as yourself.
Thank you.
Thank you.
All right, as I'm seeing that Christine also had her hand up, and I will have to join a different meeting now. I would love for Christine to ask a question. I made Nell host. Nell, would you be comfortable in taking a few more questions, and whenever you,
of course,
you have to go, move on? Okay, thank you so much. Then with that being said, I may have to remove myself in a second. Nell, I cannot thank you enough for this. You're providing an incredible leadership. The last slide is definitely everything that you're doing. Thank you so much. And I see you all maybe tonight at 6 p.m. And I will quickly share the schedule for the following meetings in this chat. And feel free to share it with anyone who could benefit from those salons. With that being said, I hand it over to Christine. Bye-bye.
Thank you.
Bye, Allison. Thanks for setting this up. Nell, hi. Fantastic presentation. I think it's both pretty darn comprehensive and a great introduction. Plus, it has some tips for people who, like me, who've even been paying very close attention since very early on, as I know you have. So really amazing presentation. I seem to recall, in terms of home crafting of masks, I seem to recall something about, you mentioned salt and iodine as a way to make the mask even more effective.
Potentially,
so,
yes.
Yeah, and so I haven't seen any links about the iodine. That's a new one for me. I did see a link about salt, and the interesting thing about that link that I ran across was something about the salt adheres better to some type of mask if you also use soap. Did you? I'm just curious if you've seen that, and if in this extremely comprehensive presentation you could include somewhere links to either the salt or the iodine procedures or I know I've seen the one about salt. I have not seen the iodine one, and yours is probably the most comprehensive presentation I've seen. So making it even more comprehensive is a high value proposition at this point.
Thank you. Well, I did include a link on that slide to an article in Nature, which discusses the use of salt. I would love to have a look at the link that you talk about, salt and soap. That sounds fascinating. And this deck, as you may have noticed, is a work in progress. So my goal is to finish it up a little bit, polish it a little bit further, and then work with some very kind NGOs to actually translate it into multiple languages. So I would love to have that info if you could kindly share it, and I'd love to bump that in there.
Great. I'm pretty sure I can find the soap information because I did put it on Facebook. So I'm betting I can find that link. So yeah, now I need to go and read that iodine paper. So yeah, with that, I'm going to step back and let somebody else ask a question. See if they know how to raise their hands. Oh, I see Diego has a hand up.
Yeah, hi. Hi, everyone.
Hi,
Nell. Nice to meet you in video. Yeah, so my question is about gloves in particular. I mean, masks secondarily. If I use gloves, can I just throw them somewhere, wait for 10 days, and then go back to using them? Like, do the viruses just die in the mid-time?
Essentially, yes. That's what I've been doing myself. So I have a Tupperware box that I keep in my red zone, and I put used gloves in there, and I write on the box when those gloves went in or the date, so I know later when it's okay to bring them out again. So yeah,
Not
I
to
mean,
be too crazy about it. Is it a problem to have a zone with multiple gloves that were put into different days?
ideally, you want to have different boxes with different days, but so long as you have a reasonably good idea of when the last date that you put something in there is, then you can feel reasonably safe about when it comes out again. I would recommend maybe about 2 weeks just to be sure, I think.
Same for masks?
Yeah, I mean, you could probably get away with 1 week, but I would recommend 2 weeks to be sure if you can. Thank you. Do we have another question? I see somebody else has raised their hand. Mike. Mike, would you like to speak?
Yes, please. Thanks. Yeah, I had a couple of questions. One is on refrigeration, because we know often biosamples are refrigerated to extend their life. So do we have any information on how much refrigeration extends the life of the COVID virus?
Yes, it does actually. So the virus denatures reasonably quickly at room temperature, or particularly in high temperatures at high humidity, sort of tropical environments. It denatures very quickly. But at cool temperatures, it tends to stick around much longer. This is why it's important not to put the virus in your fridge, because it might be there for weeks. Alternatively, it may be possible to freeze and thaw the virus to kill it. So to repeatedly like freeze a mask and then unfreeze it. But that's still a supposition. I haven't seen any good hard data on that. And in fact, with some things that might actually damage the material potentially, but something to think about anyway.
Any information on antiviral fabrics? I know Israel recently came out with an antiviral fabric, if like it has copper or zinc particles that are embedded in it.
Fascinating. I'm not aware of that, although of course we must remember that antibacterial fabrics, which are now quite common, are unlikely to do very much against the virus. I don't have any info on antiviral fabrics. And to clarify, the freezing, I didn't mean just freezing the virus. I meant repeated cycles of freezing and thawing. There's been some supposition that may help to kill the virus, but like I said, I haven't seen any hard evidence on that.
Okay. Last thing is, could it help to run the furnace in your house a few hours at 80 degrees? You know, about as hot as you can get it to go, to help kill any virus particles that might be in there?
Generally speaking, yes. If you can keep the house warm and humid, perhaps using a humidifier, that will help. Some people like to use essential oils in humidifiers. If you do, please remember that, that those can harm pets, particularly cats. So don't go bunging a whole bunch of oregano oil in your humidifier if Felix is running around. Do you have any other thoughts or questions?
I've seen people do that with bed bugs, I hear. So yeah, about how many hours would you say to run the furnace hot? What temperature would you say would work?
I mean, it's a half-life. So the longer it's at a warm and reasonably humid temperature, the faster that the level will degrade. So generally speaking, the toastier and relatively humid, sort of 40 to 60% humidity at least, the longer you can keep it like that, the better.
Okay, but you mentioned humidity too. Is that like offsetting? So when you raise temperature but lose humidity, does it like cancel out and you're not really getting any increased effect? Or is one more dominant over the other, say?
I think my understanding anyway is that both are helpful. I don't think there's necessarily a trade-off. However, running central heating, particularly in winter, can cause environments to get drier. So it may be worthwhile to ensure that you have good humidity as well if you are running the house very, very warm.
Okay, thanks. Really appreciate it. Great presentation.
Thank you. My pleasure. Any other thoughts or comments or questions? Seems not. Well, in that case, if anyone has anything else, you can always ping me on social media or email me at nell@nellwatson.com, and I'll try my best to dig up some info for you. Thank you all so much for joining. And if you found this useful, please take the recording and or the slides and distribute those to people that you think might be able to benefit. Thank you all so much.